My dear students, I hope we have done very well and you must have scored 20 out of 20 in the test series. I welcome you for the discussion series of NEET PG Forensic Medicine and Toxicology 2020 series. Okay, now coming to the first question. In case of death in police custody, the inquest is held by. I think you should know the amendment. Previously, there was some difference. Let me tell you. Now, there are two types of inquest in India as of today. Number one, police inquest as per section 194 of Bharatiya Nagarika Suraksha Samhita. That is very, very important section you should remember for your examination. It is most common type of inquest in India. Minimum level of police who can hold inquest is head constable of police. Say they say senior constable of police. Number two, magistrate inquest as per section 196 of Bharatiya Nagarika Suraksha Samhita. That is also very, very important. There are two types of magistrate, as you know. Number one, judicial magistrates. Under judicial magistrate, there are three types of judicial magistrate. About downwards, it is chief judicial magistrate of first class, and judicial magistrate of second class. Number two, executive magistrate or non-judicial magistrate. They are usually revenue officers like district magistrate, additional district magistrate, subdivisional magistrate, or district collector or commissioner, assistant collector or commissioner, tahsildar, deputy tahsildar, etc. Okay. As you know, usually police will hold inquest, but magistrate inquest has to be done in following condition. Number one, that while under police interrogation. Number two, due to police firing or death due to police fire, lathi charge. Or number three, if death takes place in police custody, or if rape takes place in police custody, or a person disappears from the police custody. Police custody means not only police custody, anytime, whenever the magistrate or court keep a person in a custody like jail means prison, remand home, boston school, rehabilitative school, lots of things. Okay. So, of a mentally ill prisoner in a psychiatric hospital. Most of the books say, or your teachers also teach you that death in psychiatric hospital inquest should be done by magistrate, and not like that. Death of a mentally ill prisoner in a psychiatric hospital. Number four, if a woman commits suicide or if her death takes place under suspicious conditions within 7 years after marriage, just to rule out dowry death. Number six, in case of exhumation means disinterment. In all such cases, magistrate inquest is compulsory. See, before this Bharatiya Nyaya Suraksha Samhita, under clause number 3, as you see here, that a death slash rape slash disappearance of a person in police custody, only judicial magistrate should have done inquest. But as of now, after VNSS, it is not compulsorily by a judicial magistrate, any magistrate can do. So here, in case of death in police custody, the inquest is held by the answer is not judicial magistrate, either executive or judicial magistrate. Okay, remember. Number two, perjury is punishable under which section of Bharatiya Nyaya Samhita? Let me discuss about these four sections. Very, very important. Out of these four, most important section is 229 of Bharatiya Nyaya Samhita. So here, 227 defines what is perjury. Perjury means giving false evidence in a court of law under oath or solemn affirmation. So it has been defined under section 229. 229 section of BNS defines what do you mean by fabrication of false evidence. Only definition, not punishment. 229 is penalizing section for both 227 and 228 of BNS. That means perjury or fabrication of perjury, false evidence is punishable under section 229 of Bharatiya Nyaya Samhita. 234, not much important, but just remember, sometimes they may ask. Okay, it is issuing or signing false certificate. Punishment for perjury is maximum 7 years of imprisonment. At the same time, issuing or signing for false certificate also punishment similar to section 229, as same as for giving false evidence. That means 7 years maximum imprisonment. Now you got the answer. Perjury is punishable under section 229 of Bharatiya Nyaya Samhita. Number three, direction given by a person that in future If he or she becomes terminally ill and becomes an incompetent patient, incompetent means is not in a composement is or is paralyzed or is unconscious, whatever it is, whether to give medical treatment or not. Let me discuss one by one. Now coming to the advanced directive. There is difference between advanced medical directive and advanced directive. Advanced directive means a mentally ill person in lucid interval or even a normal person, if at all he becomes mentally ill in future, whether he should be cared or not, or in case he wants to be cared, then who will be his nominated representative? So this is as per Mental Health Care Act 2017. Every person who is not a minor have a right to make an advance directive in writing stating that the way the person wishes to be cared or not to be cared for and treated for mental illness. Number two, the individual or individuals in order of precedence, the nominated representative, whether in my case, for example, whether my wife or son or daughter, whatever it is. Okay. Number two, advanced medical directive. It's not given under law, but Supreme Court has recognized advanced medical directive, which is also known as living will. When you are living, you are getting a will. Stating what? But one thing, you should be a major and it should be in a composement is so direction given by an adult in his conscious mind that his future should become permanently ill. Say, for example, advanced malignancy, for example, and he becomes an incompetent patient. Then whether to give medical treatment or not. Okay. That is advanced medical directive, also known as living will. So now here you already got the answer. Answer is advanced medical directive. Testamentary capacity, you know very well. Ability of a person or capacity of a person to make a valid will. Okay. Palliative care, you are not giving exact treatment from the cure, but you are lessening the symptoms or pain. Okay. That is known as palliative care. It is a general knowledge. Number four, in case of kleptomania, whether the person is punishable or not. Punishable. If he's not punishable, finish. If he's punishable, be section. Whether it's 22, 23, 24, let me discuss in detail on that. Section 22 of Bharatiya Nyaya Samhita, before it was 84 of IPC, now no need to bother about the IPC, derived from McNaughton's rule. What it says is, nothing is an offense which is done by a person who at the time of doing it, by reason of unsoundness of mind, is incapable of knowing the nature of the act or that what he is doing is either wrong or contrary to law. Okay, that means number one, he should be mentally ill, means there should be unsoundness of mind. Number two, he should be incapable of knowing what he is doing, means this the act. Or even if he knows the nature, he should not know whether it is right or wrong. Of course, ignorance of law is, in a normal person, ignorance of law is not an excuse according to law. Okay. Now, coming to the criminal responsibility of a mentally ill person. If at all a question is asked whether the person is liable or not, you ask two questions. The first question is, does he know what is he doing? Now, answer may be no or yes. If answer is no, he is not liable. If answer is yes, ask second question, does he know what he is doing is right or wrong? Now, again, answer may be no or yes. If the answer is no, again, he is not liable. And if the answer is yes, then he is liable. Now, coming back to kleptomania. In kleptomania, he knows very well what you're doing. And also, he knows very well what you're doing is wrong. In spite of that, he's doing that. That's why he is punishable. And in India, there is no scope for partial responsibility or diminished responsibility. All or none phenomenon. Punishable or not punishable. So, kleptomania is punishable. Now, what about delirium? Delirium, you know very well. Acute confusional status because of cloudiness of mind. He does not know what he is doing, not liable. Automatism, conscious performance of an act of what he is unaware, over which he does not have conscious control. So he is not liable. Epilepsy, of course, it is a natural disease. During horror, he may commit some offense or any act, he is not liable. Somnambulism, it depends. If it is first offense, he may not be liable, but once he comes to know that he is suffering from somnambulism and he may become a source of danger to himself or other, himself is no problem, he become a source of danger to others, He should take proper care not to repeat the same. Say, for example, if he's sleeping in a single room, he should ask his friends or parents to lock him from outside. Even if he get up, he should not go out and commit any offense. Hypnosis. Nobody can be hypnotized without his consent. So here, both hypnotizer and hypnotizee are punishable. Both are liable. Now, coming to the intoxication. Intoxication, a person may get intoxicated maybe of his own or maybe unknown. Unknown means somebody else may introduce some intoxicating agent into his food or drink. So now, in case of involuntary intoxication, the person is not liable as per section 23 of Bharatiya Nyaya Samhita. The one who intoxicated him becomes liable. At the same time, as per section 24 of BNS, if a person gets intoxicated of his own, even if he loses control on his mental faculties, he becomes liable as per section 24 of Bharatiya Nyaya Samhita. Now, you got the answer is punishable under section 22 of BNS. Very, very important section. You should remember. Number 5, by medical negligence by a doctor can be booked under which BNS section? Previously, death was punishable under section 304A of IPC, Rash and Negligent Act, resulting in death of a person. But here you remember all these 4 sections are for Rash and Negligent Act. BNS section related to Rash and Negligent Act by a doctor. Number 1, section 125, endangering the life of a person. Rash and Negligent Act, endangering the life of a person, punishable under section 125. For example, a doctor injects penicillin without test dose. It endangers the life of a person. Or if at all, by the Rash and Negligent Act, if the doctor causes hurt to the patient, he is punishable under section 125A of BNS. If he causes a grievous hurt, is punishable under section 125B of BNS. And if death takes place by rash and negligent act of the doctor, is punishment under section 106 of Bharatiya Nyaya Samhita. You have to remember the punishment also maximum 2 years imprisonment for the doctor. For others, for example, a driver out of negligent act, if he kills a person, then he is punishable up to 5 years. But doctors, it's 2 years. So now he got the answer. It is 106. Number 6. Look here. Following is the victim of firearm imprisonment for the doctor. For example, driver. What is the suspected distance of the shot? Now, let me discuss in detail about appearance of wound at various ranges by a rifle fire. Now, first you should know what are the products of firing. Once you fire, firearm, rifle firearm especially. Now I'm talking about that. What are the products of fire? You can see here, you can see the flame. Along with flame, definitely there will be hot air. Then you can see the soot and smoke, and also you can see the bullet. Now you see here properly, there will be flame plus hot air. Then there will be smoke and soot and gunpowder. Some powder burns completely, which causes soot and smoke. Some are partially burnt and unburnt, that is powder particles. And lastly, the bullet. So here, next you should know what are the effects of these products of firing. Flame and hot air. Once it touches the skin or cloth, whatever it is, okay, forget about the cloth. Now we are talking about the skin. It causes burning or scorching of the skin as well as burning of the hair, known as sinning of the hair. Okay. Okay. At the same time, if the soot touches blackening or smudging, powder particles penetrate into the epidermis, get embedded in the dermis, give rise to a condition called tattooing or powder stippling or peppering. And lastly, the bullet causes wound of entry. Along with wound of entry, there may be grease collar and abrasion collar. This is the basic. Now, coming to the distance shot. You see this picture. If 50 meters the distance shot, only the bullet hits the body. Then you get wound of entry surrounded by grease collar as well as abrasion collar. You can see the actual picture. Of course, grease collar is not always easy to identify. See, in this picture, you cannot see the grease collar. You can see abrasion collar. I can see it is a distant shot. Now, to intermediate shot means the target is beyond the reach of the smoke and soot, but within the reach of the powder particles. Now, in addition to the wound of entry with grease and abrasion color, there will be tattooing. Tattooing. See the actual picture. Now we can say it is intermediate shot. Number three, near shot. As you see, the target is beyond the reach of the flame, but within the reach of the smoke and soot. B to C. Here, picture will be similar to intermediate range, but in addition to that, there will be blackening or smudge. Look here. You can see the tattooing. At the same time, you can see the blackening. Now you see the difference. Intermediate and near. Close range means the target is within the reach of the flame. So in addition to all this, what you see in near shot, you get the burning or scorching as well as singing. Now I enlarge the picture. You see, you can see the burning. Okay. Lastly, see exactly the difference. Keep that in your mind. It's very easy. Okay. Okay. Now, contact shot. Three types of contact shot. Number one, tight contact. Tight contact means there is indentation of the skin, as you see in this picture. Indentation. Look here. Indentation. It is also known as firm contact or hard contact. There is indentation of skin. Because of that, absolutely no gap between the muscle and the skin. All the products of firing will enter into the wound tract. Okay. Enter into the wound tract. So what you get is the muscle impression. Muscle impression you get. Okay. And you can see the blunt edge also you can see. With burnt edge because of the heating, you can see the burnt edge. Two, loose contact. Loose contact means muscle is touching the skin, but there is no indentation is not there. So what happens is at the time the bullet causes invagination of the skin while penetrating the skin, there will be a gap. See here in the picture as I showed in red arrow. Through the gap, the smoke and soot as well as the flame and hot air escape, which causes blackening around the wound of entry known as corona. So findings are number one, abrasion grease color. Number two, blackening known as corona. In addition to that, there may be burning of the skin, seeing it blackened. Okay. And muscle impression is normally not seen because of that gap. Okay. Now, see how to differentiate between loose contact and near shot. Loose contact, there is no tattooing. Near shot, there is tattooing. Okay. Okay. Number three, angled contact means the muzzle is kept at an angle, as you see in this picture. There is an angle. And now, through the angle, all the products of firing will escape except the bullet. So, all these products of firing spread in an overt manner, as you see in this picture. So, findings, what you see is the blackening, tattooing, burning, singeing, abrasion and grease color sometimes, plus partial muscle impression. Where the muscle is touching, you may get a muscle impression. But normally the wound of entry will be circular or ovoid. Tangential entry, it is ovoid, either it is circle. But in case of contact wound on the head or sternum, there is loose tissue in between. The gas get escaped and form a temporary bulge. Soon after, most of the time, contact shots are suicidal in nature. As soon as the person drops the gun, whatever gas is collected try to come out through the same wound of entry by splitting the skin. By splitting the skin. So you get cruciate or irregular shape with a large wound. Cruciate or tail shape and large irregular wound. Okay. Now, see the picture. Whenever you see cruciate, immediately you can say that is contact shot. So now you got the answer. Easy. Near shot. Okay. How many of you have done all six correct so far? Tell me. I've done all six. Correct? Okay. All the following are associated with burns of hydrochloric acid except, you know very well, acids always cause coagulative necrosis, but exception is hydrofluoric acid, which causes liquefactive necrosis. All other acid like hydrochloric acid, nitric acid, sulfuric acid causes coagulative necrosis. But here it causes liquefactive necrosis like alkalis. So there will be severe throbbing pain and tissue necrosis and destruction. In addition to that, because it is an acid, there will be acidosis, there will be hypocalcemia, hypomagnesemia, but hyperkalemia. Hyperkalemia, remember that. In about 2019 in JUPMAS, they asked 3 questions from hydrofluoric acid. Okay. Now, treatment, as you know very well, calcium gluconate. And answer already got. Answer is D, decreased potassium. It is hyperkalemia. Which of the following is the feature of female skull? Now, let me differentiate between the male and female skull. Always, male bones are always heavier, larger, female smaller and lighter. Cranial capacity is about every 1.5 liters in case of males, about 1.3 to 3.5 in case of females. Now, forehead. Forehead is sloping in case of males, somewhat vertical in case of females. Now, look here. Males sloping, female vertical. All the prominences are more pronounced or prominent, but there is one exception. I'm going to tell glabella, supraorbital ridges, zygoma, mustard process, occipital protuberance, occipital condyles, all are more pronounced. The muscular attachments are more pronounced in case of males. Okay. Now, I show you in the picture. You see the glabella, prominent in male, less prominent in female. Supraorbital ridges also prominent in males, less prominent in females. Zygoma is also prominent in males, less prominent in females. Master process is more prominent in males, less prominent. I show you another picture. Look here. See another picture. Master process. Muscular attachments are more pronounced in case of males, less pronounced in case of females. Frontonasal angle is distinct in case of males. That is because once the glabella is prominent, the angle becomes distinct as you see in the arrow. Whereas in female, the glabella is not prominent. Frontonasal angle, the angle formed between the frontal bone and the nasal bone, it is less distinct. Okay. Now, as I told, there is one exception. The frontal and parietal eminences are less prominent in males, more prominent in females. Look here. Okay, males it is not prominent, female prominent, both frontal and parietal. And orbital opening somewhat rectangular in case of males and rounded in case of females. Now we know all the differences. Now, see, whatever I have mentioned under red color is very important. You have to remember. So here you already got the answer. Less prominent parietal eminence, yes, but prominent frontal eminence is wrong. Okay. Anyhow, it is grievous provided the victim is unable to follow his ordinary pursuit for a minimum period. Of course, the same question has been asked in INISET examination, also recent INISET examination. And for RDX, that is rapid rank deciding series of INISET also, whatever the 20 questions I asked, 3 to 4 questions have come in this INISET exam. Okay. Section 116 of Bharatiya Nyaya Samhita defines what is grievous hurt. There are 8 clauses. Number 1, emasculation means loss of power of erection of penis. That is only for males. Number 2, permanent privation of the sight of the either eye. Privation means loss. And this loss must be permanent. It may be temporary, it may be partial or complete, but it should be permanent. Number 3, permanent privation of the hearing of the either ear. Okay. Number 4, privation of any member or joint. What do you mean by member? Any part or organ of the body which has got its own function. Say, for example, finger is a member, tongue is a member, nose also a member, ear also, pin also a member. Okay. Even fingernail is also a member because main function of the fingernail is scratching. Number 5, destruction or permanently impairing the powers of any member or joint. Destruction or permanently impairing. Say, for example, take a scalpel and only the radial nerve or ulnar nerve, or you cut a muscle tendon, then there is permanent impairment. Number six, permanent disfiguration of the head or face. It was subjective, but in your exam level, you just think if at all there is any scar formation of the face or head is grievous. For example, in this picture, 100%, anybody 100 out of 100 will tell that it is grievous hurt because it is really disfigured. But now it is up to the judge or magistrate to decide whether it is grievous hurt or not. But you consider this, any scar, you consider as disfiguration. Number seven, fracture or dislocation of your bone or tooth. Fracture or dislocation. Your subluxation also falls under dislocation. Number eight, any hurt will endangers the life of the person. For example, stabbing into the abdomen or any hurt which causes the sufferer to be during the space of 15 days in severe bodily pain or unable to follow his ordinary pursuit. Previously, under 20 IPC, it was 20 days, but now it is only 15 days. That change is done in section 116 of Bharatiya Nyaya Samhita. Okay. So remember, sometimes they ask hospitalization for 15 days, it is grievous or not. Just hospitalization, mere hospitalization, not a grievous. He should be under severe bodily pain or unable to follow his ordinary pursuits. Okay. So all these together. Now already got the answer. Answer is 15 days. Yeah, some student asked about corneal abrasion. Yes, correct. Corneal abrasion can be a grievous because on healing it may cause opacity of the cornea. The maximum age of the person by the analysis of the carpal bones in this X-ray is, many times they ask from carpal bones. Let me teach you in detail about carpal bones. Okay, now see here. There are 8 carpal bones. Proximal 4, distal 4. Let me name one by one. Out of all these, the first carpal bone to appear is capitate, 2 months. See, lowest alphabet is C. Remember, 2 months. Then comes the hamate, 3 months. Then it goes anti-clockwise. Then it comes triquetrum. Tri means 3 years. Next is lunate, L. Look like 4 when you write 4. Okay, 4 years. Other 3 bones, that is scaphoid, trapezium, trapezoid, 4 to 5 years. Lastly, the pisiform, 9 to 12 years. Okay. Many times students make a mistake. Sometimes some students find it difficult to differentiate whether pisiform is appeared or not. Okay, I will show you X-ray and discuss. A child of 1 year will have 2 carpal bones. 2 years will have 2 carpal bones. 3 years will have 3 carpal bones. 4 years will have 4 carpal bones. 5 years will have 7 carpal bones. And 12-year-old child will have all 8 carpal bones. Okay. Now, look here. There is always overlapping of pisiform with triquetrum. Always partial overlapping trapezium, trapezoid. Nothing to that. How to differentiate? You can see the double density and the line of demarcation can be seen. Line of demarcation, double density. Then you can say whether pisiform appeared or not. Or here also you can see double density. Okay. Now, which of the carpal bone is first to ossify? The first ossify is capitate. What is the predicted bone age from the wrist radiograph given below? All carpal bones except pisiform 9 to 12. Okay. Okay, sometimes some students said pisiform 12. Of course, see, the problem is, no, different books give different values. Now, what I referred is Dr. Anil Agarwal's textbook. Okay. Different books, Gautam Biswas says one thing, Naran Reddy says one thing, Pillai says something like that. Okay. Now, all carpal bones except pisiform age is less than 12 years, so best answer is less than 15 years. Determine the age of the individual. 4 carpal bones, lunate is seen. Okay, so 4 years. Now, 3 carpal bones, triquetrum, third bone, 3 years. Now, what is the age? 2. Maximum 2 years. It cannot be 3 years. 3 means triquetrum should come. So now 2 years. Okay. Determine the age of the individual. No carpal bones at all. Less than 1 year. Less than 1. Now, coming back here, all carpal bones appeared less than 12 years. All carpal bones except pisiform less than 12 years. So what would be the maximum? Maximum is 10 years. Okay, I hope all of you understood properly. Okay. 38-year-old female presented to the emergency with extensive burn. The patient had grade 3 burns on the face, back, upper arms, and forearms, along with singeing of face. Which of the following, though, is not a proof of inhalation? See, I have seen many surgery teachers also say answer is yellow colored sputum. That is wrong, actually. First, you should know what do you mean by inhalational burns. By definition, inhalation burns means burns of the nasopharynx, oropharynx, or even trachea, bronchi, or lungs from exposure to hot air or hot smoke. Okay, you understood? Now, you see, one couple is there within burning house. Burns has not touched the person, but inside they are inhaling the hot air. They may suffer from inhalation and burn. Of course, they may die by carbon monoxide poisoning also. That is secondary. Okay. And there may not be any body burns. Actual burns may not be there, but inhalation burns may be there. So here, what happens is, number one, hypoxia because flame utilizes the available oxygen. Number two, hoarseness of voice and stridor because of the hot air and smoke causes injury to the laryngeal mucosa. Number three, they inhale the flying ashes. There is better position of soot in the trachea. Number four, yellow sputum. Why yellow sputum? Yellow sputum because oxides of nitrogen converts the sputum into yellow. I can show you because always in my teaching I give the proper reference like I-shaped incision. Y-shape and modified Y, what is given in Naran Reddy is wrong. Barnanite has given perfectly. Then N block and N mass technique is known as Little's technique, but many books are mentioning Bond's technique is N block. That is not N block, that is block by block. Reference I gave from Barnanite. Then most common branch to cause extradural hemorrhage is not anterior branch of middle meningeal artery. It is posterior branch of middle meningeal artery. You can see yellow for this sputum. That is because of the oxides of nitrogen. Proper reference. See, singeing of the eyebrows will not be caused by inhalational burn. To cause singeing of the hair, there should be actual flame touching the hair. Otherwise, even if you use a hair dryer, it should get singeing of the hair. Okay. Which is the wrong statement regarding snake venom and PASV. Okay, now let me know what answer you have given for this. What is the answer? Same dose of PASV in infants as compared to adults. That is because your idea is to neutralize the injected venom, not PASV. Don't give per kg body weight. Your idea is to neutralize the injected venom. That is true. Sensitive test is not required. No, 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 no. It is not required. If at all any reaction takes place, then you can counteract that. Okay. Common cobra venom acts at postsynaptic region. Okay. That means the neurotoxin get fixed in the postsynaptic region case of common cobra. That's why neostigmine should be given in common cobra. Whereas in common grade, toxins get fixed in presynaptic region. No need of giving neostigmine. So now already got the answer. Common cobra venom acts as presynaptic is the wrong. Now, lastly, internal external ophthalmoplegia is ptosis. First the neurological external sign is ptosis by neurotoxins. Neurotoxin is common cobra and common creek. Okay. So that is also true. So now already got the answer. Number 13, Section 90 of Bharatiya Nyaya Samhita deals with. This is also very, very important section you should remember, especially three sections, very, very important. Abortion, in law we call it as miscarriage, punishable under section 88 to 92 of Bharatiya Nyaya Samhita. What is the definition? As per Williams Obstetrics, expulsion of the products of conception before viability is miscarriage or abortion. But as per law, expulsion of the products of conception at any time before full term is known as miscarriage. Even at 36 weeks or 38 weeks also it is called miscarriage. It may be spontaneous or artificial, spontaneous, natural and accidental, the causes under obstetrics. Artificial, it may be criminal abortion or justifiable abortion. If the woman terminates her pregnancy under the provisions of Medical Termination Pregnancy Act, then it is justifiable. If not, then it is criminal, punishable under five sections, but three sections very important. Number one, 88. 88 BNS with the consent of the mother. 89 BNS without the consent of the mother. Mother means not the pregnant woman's mother, mother of the fetus. And if that causes by criminal abortion, then punishable under section 90 of Bharatiya Nyaya Samhita. All these three sections very, very important. 91. Preventing the child being born alive or to cause to die of tetanus. Say, for example, woman is desperate, she won't hitting or jumping from lorry, jumping from height to get rid of the process of conception. 92 is if at all a person try to assault or kill a woman, but by that time, if abortion takes place, then he is punishable under section 92 of Bharatiya Nyaya Samhita. Those two are not much important. So now the answer is causing death of the mother by miscarriage. 88, 89, 90. According to the MT Pact 2021, in case of pregnancy due to contraceptive failure, MTP is allowed till what gestation? You see, frequently they ask question from MTP Act since about 2 to 3 years, but in INICET also they ask a question, but that is a wrong question. They ask a question, what is the minimum age for MTP? There is nothing like minimum age for MTP. Remember, minimum age to give consent is 18 years. Okay. Anyway, let me discuss in detail about MTP because it is very, very important. Salient features of 1971 MTP Act, 2021 MTP rules, and Supreme Court ruling. See, there are four grounds of MTP. Number one, therapeutic ground. If the continuation of pregnancy endangers the life of the mother. Number two, social. If the pregnancy causes by contraceptive failure in any woman, previously it was only in a married woman, now any woman or her partner. Number three, because what they say is it gives rise to grave injury to the mental health of the pregnant. Number three, humanitarian, same reason, grave injury to the mental health of the pregnant woman if pregnancy caused by rape. Number four, eugenic, if it there are chances of getting some congenital anomalies if pregnancy continues and if she gives birth to a baby. Substantial risk. Okay. Now, normally, under normal circumstances, MTP is allowed up to 24 weeks. There are some other clauses I will tell you, but after 20 weeks, opinion of one RMP is sufficient. 20 to 24 weeks, opinion of two RMPs. Opinion of two RMPs required. Now, what are the grounds for termination of pregnancy up to 20 weeks? Only in case of contraceptive failure in a woman or partner. In case of contraceptive failure, termination can be done only up to 20 weeks, not up to 24 weeks. Number two, up to 24 weeks in case of number one, rape. Meantime, forced sex by the husband on the wife, and if she becomes pregnant, she can also terminate pregnancy. That is as per Supreme Court ruling. The MTP Act it is not. There is no marital rape in India. Okay. Dr. Narayan textbook has mentioned marital rape is there, but marital rape is not there in India. Okay. Incest. Pregnancy caused by incestual relationship. Number three, in case of minors, less than 18 years. Number four, change of marital status may be by the death of the husband or by divorce. Number five, in case of woman with physical disability. And number six, mentally ill woman or mentally retarded woman, fetal malformation. And lastly, in humanitarian settings, say for example, drought, famine, also things, if government announces humanitarian setting or emergency situation, that time it can be terminated very rarely. Okay. Up to 24 weeks, okay. What about after 24 weeks? Even after 24 weeks, termination can be done, but It has to be passed by a medical board. Medical board has to say that there is substantial fetal anomaly or abnormality consisting of four members. Number one, a gynecologist. Number two, a pediatrician. Number three, a radiologist or sonologist. Number four, any other doctor nominated by the God. Doctor only, not lawyer or anyone. Okay. And lastly, FTP can be done at any gestational period, even by a single RMP, if the continuation endangers the life of the woman. Okay, all this. Consent of the woman is very, very important. Written consent. Husband consent is not required in case of married woman. And if the age is less than 18 years, or if the woman is mentally ill, or if she is incompetent to give consent, legal guardian's consent is important. Legal guardian's consent is important. And always you should maintain the privacy of the woman. Meantime, you have to maintain an admission register for a period of 5 years. And information has to be given to the Director of Health Services or Director of Health DHU, District Health Officer. Okay. Every month you should say. All these are regarding MTP Act. So here, conceptive failure, answer is 20 weeks. The type of stab wound caused by a screwdriver over the thigh. See, stab wound classification depending on where it has entered into the body, whether it has entered into a body cavity or not, or whether it has formed wound of exit. If the stab enters into a cavity, means major cavity like cranium, thorax, and abdomen, it is known as penetrating stab or penetrated wound. Other than the cavity like cheek, deltoid, thigh, buttock, punctured, entry and exit, perforated wound. There are two types of pointed weapon. Number one, sharp pointed weapon like a knife. If I stab a person with a knife, external injury look like an incise. Meantime, if I take a iron rod and stab a person, external wound look like a lacerated wound. So depending on that, again, it is further subclassified under two headings. Incise, penetrated, penetrated, incise, punctured, incise, perforated, lacerated, perforated. Okay. Now, look here, double-edged knife. Incise, perforated. Incise, penetrated. Lacerated, penetrated. The type of stab wound caused by screwdriver over the screwdriver, lacerated. Thigh, punctured. Answer is lacerated, punctured. So here, none of the okay. Regarding semen, statement is normally they ask one question from forensic science laboratory. Let me tell you in detail about what the different tests for semen. Semen is derived from secretion from the testes, spermatozoa and epithelial cells. Number two, from the seminal vesicle, choline and lecithin. Number three, from the prostate, acid phosphatase and sperm. Okay. Here I will tell you what is most important. Just remember what are the tests used for semen. Confirmative test and presumptive sign or presumptive test, or what you call screening test. How to say 100% is semen? There are two. Number one, presence of spermatozoa under microscope. 100% you can say it is semen. Number two, presence of LDH isoenzyme, sperm specific LDH isoenzyme by electrophoresis. These are the two tests. 100% you can say it is sperm. What are the presumptive or screening tests? So many are there. Ultraviolet rays, you just pass ultraviolet light in the dark, you can see blue-white color. Number two, SAP test or seminal acid phosphate test. It was one of the most commonly done tests. Okay. Barber's test frequently asked since about 5 years, NEET, even NEET PG, FMG, all exams they asked. Barbarity is a microscopic test where you see yellow needle-shaped crystal sauce, spermine picrate. You remember BSP, Barbarous spermine picrate. Okay. yellow needle-shaped crystals. Remember, barber you have to remember. Number 4, fluorine test where you can see dark brown rhombic crystals are cholinide. Number 5, prostate specific antigen or P30. P30. Strictly speaking, the more specific than acid phosphatase test. Okay, it is better. And if the cloth is preserved well after drying, it can detect even up to 10 years. And as of today, it is most accepted method for identification center. Okay. Okay. Presence of P30. Thin layer chromatography, remember that you can identify both choline and spermine. Number 7, creatine phosphokinase, even up to 6 months, you can identify the cell. Number 8, presence of epithelial Y chromosome by fluorescent in situ hybridization. Number 9, zinc test because prostatic secretion rich in zinc. Number 10, rapid stain identification series test or SID. So all these 10. Okay. But keep in your mind, but most important is Barber's test, BST. Now here you got the answer. The answer, fluorine test wrong because it is Barber's test, Barberio, that is fluorine test. Both choline and spermine, right? This is sperm cell cannot confirm semen stain. No, it can confirm semen stain. Okay. Who is a mule? Comes under substance abuse. Mule is also known as body pack. You must have read in the newspaper many times. That is illicit drugs like cocaine. They swallow. And pack is GIT with bags of illicit drugs to smuggle. Okay, I will show you. Look here. This is body packer or body packer syndrome. Sometimes it may rupture, person may die. So best method to identify cocaine packets in abdomen is CT scan. Number 2, body pushing. Here, he pushes the drugs into some external cavities. Okay, external cavity, maybe in the rectum or in the vagina, sometimes even in the nostril, rarely maybe into ear, that is body pusher. Number 3, body stuffer. He'll be carrying, but as soon as he's about to catch, immediately swallow. It is not pre-planned. Okay, that is known as. See here you can see the body pusher. See the drugs in the vagina. Okay, body stuffer. We just drug in pushing. Conceal the evidence from police. So, by the time he's coming in the airport, he got one bag. When he is about, then he just stuffed. He conceal. That is body stuffer. Okay. So, mule is a body pack. State consumer dispute redressal commission can pass maximum compensation of. See, actually, originally they were different. It was up to 2 crores district commission, 2 crores, 1 rupee to 10 crores state, more than 10 crores national. But lot of cases went into district. So there is one amendment for Consumer Protection Act 2019. According to that, there are 3 levels of consumer dispute redressal commission. District commission can pass compensation up to 50 lakhs. See, even in Narayana textbook, they have mentioned up to 2 crores, but amendment is not given. But Dr. Gautam Buddha Vishwa's recent edition, he has mentioned clear. State commission more than 50 lakhs, but less than 2 crore. National commission more than 2 crores. Okay. So answer is 2 crores. Now, thick teeth in decomposed bodies is seen in case of death due to. What is the answer you have written? What is the answer? Look here. Many people think maybe asphyxia, maybe carbon monoxide poisoning or cyanide poisoning. Actually, it is nowhere related to any causes of death. It is because of the seepage of hemoglobin and its derivatives into the dentinal tubules, normally seen in case of immersed bodies recovered from water, especially when it is there for about 1 to 2 weeks. no way related to causal. So answer is none of the above. None of the above. Okay. Now, coming to the last question, which among the following is the en bloc method used in autopsy? I tell you, many teachers also teaching wrongly, according to me. According to them, they are right. But I will give you proper reference also. Lead tools is en mass or en bloc. Gauss is block by block. Workhorse is organ by organ. Rakutansky is in situ dissection. Okay. Now, en mass means in a group or all together. En block also same meaning, all together or all at the same time. That means right from the tongue, neck structure, thoracic structures, abdominal structure, up to the rectum, A to Z, removed as a single large organ block. That's it known as N block BLOC. It is not BLOCK. Whereas Gauss technique is known as block by block. I will explain. Okay. See, always I say in my teaching, I give proper reference. Bernard Knight is one of the top class authors. Everybody except Bernard Knight. He has mentioned clearly, removed N block by a modified recognition procedure, more accurately described as Letius method. Okay. Oral, cervical, thoracic, abdomen, pelvic organ removed as one large organ block. Commonly done in medical college to UG and PG students. Number two, Gauss technique, block by block dissection means maybe cervical and thoracic as one block, abdominal organs as one block, urogeneral system as one block, depends, whatever they are interested. Say hepatobiliary system as one block, then it is known as block by block dissection. Like in multiple flats, they call block A, block B, block C. Like number three, workhorse technique, most common in India, organ by organ removal. Lastly, Rokitansky technique. Okay, Rokitansky technique. If you know very well that the body is infected by HIV or COVID or HBsAg or any other infectious diseases or even rabies, or if you suspect infection, then you go for in situ dissection. Just open the cavity, don't manipulate very much. That is Rokitansky. You can remember, don't worry, GB lay. We workhorse organ by organ or Rokitansky in situ. G Gauss block by block. L Letius N block or N mass technique. So which among the following is the N block method used in autopsy? The answer is Letius technique, not Gauss technique. Okay. Wish you all the best. You have another 1 month. Do well. Don't get tension or stress unnecessarily. Many students call me and say, I've done 10 silly mistakes, all because of your stress. The day I was studying, last 1 month, don't read any fresh topic. Revise, revise, revise. Okay. Then sleep properly before night of the exam. Go calmly with compose mentis. Read the questions and options properly and mind. Don't think about the result. Just do your duty. That's all. Like in Bhagavad Gita, they say, Karmanyavadi karaste mafalishu katacha. You have to do your karma. The result later. Okay. Wish all the best. Thank you very much for patiently listening. Bye bye.